What's up, guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we'll be covering how to build a good communication with Rapid, or the code stroke team that comes into your hospital. Usually you'll have one designated like doctor that kind of does the code stroke / Rapid / anything. We call them the house supervisor type thing. So to give you context, I work at a Trauma 3 ER. Well, I mean the whole hospital, but we stay in the ER. So for this particular situation with them, they kind of mean business, because usually when they call, that means someone's like, either they coded, they're currently coding, or they're like really bad. They can't breathe. Usually, most of the time, it's like they can't breathe, or they think maybe they aspirated, or they have pneumonia type situation. So for those, you kind of like, when they call you gotta go over there. Like unless you're currently in a trauma, both are in a trauma, y'all have to shimmy over there, because usually it mean business. And I think like the biggest way to build rapport with them, it's kind of like when they call, you make sure you go over there right away, or if they have a missed call, make sure you call, because they usually need a chest x-ray. Most of the time, it's always been a chest x-ray. Occasionally we'll shoot like a KUB if they want to see like if their NG tube or OG tubes in place, but majority of the time it is chest x-ray. Or sometimes they'll be downstairs in the ER with like code stroke patients, and they'll need us to take x-rays while there's the neuro doctor there assessing the patients for the code stroke. But usually when the house supervisor's there, or the Rapid, whatever, usually if it's a stroke, they'll be with CT, and then we're towards the end of the whole little list of stuff to do protocol type things. So that's going on. I would for sure have their number, because occasionally when we're on the floor, you get disconnected. Like we have a little portable phone thing. It gets disconnected half of the time. And then if someone calls and they really need you, it's better to kind of have, they can like shoot you a message on your personal cell phone. Be like, hey, we need you, like type deal. That's kind of a safety net we've been using, because unless you have like good connection there. So you can do that. I mean, I would say it's like it's pretty serious with them, because like if you consistently aren't there in time, like you can get righted up, or like you can end up getting fired. There's been people who kind of brush them off and end up getting fired. Like I learned that on my first day on the job. Like my supervisor's like, look, there's a few people you'll mess with, and they mean business, because you can get fired, and people have gotten fired. And they literally told me who they were. It's like, if they call, you better be there. Or unless like it's some serious stuff, you gotta let them know why you late, because it could be like a life or death type situation, some of these patients. So but for the most part, we have a pretty good relationship with them. And then following them, I would think the next one would be like the like main hook of the ER would be the next kind of one that would fall. And then, I mean, of course, radiologist. Of course, you put the radiologist up there if he's like doing a procedure, and he's in this is for night shift. Yes, he's like in the department. I would also put him up top. You don't want to make him wait, type deal, because usually they get called in, and they try to look at the picture and then bounce. So that's another big one for them. But yeah, that kind of really sums it up. It's not that, I don't think it's that difficult. I haven't had any problems with them. Occasionally you will get is that they'll call you, and then they're either actively, the patient will like begin to code, or like there's a bunch of nurses and other doctors in the way, because he is a doctor, but like there is also like the other doctors who are like if they're different floors, they'll be like the doctor who runs that department type place, or if the patient's like showing certain symptoms related to maybe another doctor's specialty, they'll bring him in type thing. So there'll be multiple people there. So sometimes it's like very, very cluttered. And then especially, you carry a big old tank with you, it's kind of hard to shimmy around. And it's kind of like, there's been people that like the doctors want it and the nurses or respiratory won't get in the way. Like just be there doing some kind of work and stuff, and you're like, oh, well, the doctor needs his picture, you better move. Like you'll be rotoring, be like, come on, get out. And sometimes like the doctor will have to like yell at them, be like, come on, get out the way, they're gonna shoot, or you gotta shoot it, you're about to get like, radiated type deal. So that's something that can happen. Try not to. I mean, there's some like nurses and stuff that's like, fine, whatever, shoot it, it's fine type deal. So you can kind of use your judgment. But like, even if the person doesn't mind getting shot at, always ask, because maybe that today's the day they care and you shot them and now you got reported type deal. That's something to keep in mind in those situations. Other times they'll call you, and then by the time you get there, they're already like getting a chest tube done, or maybe like they're getting some kind of like stamp put in, and you'll have what we call like the cardiologist type doctor that does the things there. So maybe sometimes you'll have to wait a little bit. So that's something you have to keep. All this is just general information. Depending on where you work and everything, they'll have their own kind of deal they do, and with time you'll kind of gauge how to play the smarter game and be the most efficient you can. Because the worst thing that can happen is you go up there with your partner, because ours is only 2 of them, and you just wait and you wait, and then you have your phone looking at what the ER or the rest of the hospital and just stacking, and then you're just like, okay, well, one of us got to bounce to hold it down, or else we're gonna come back to like cluster of exams. So that's something that you kind of have to keep in mind with that. So kind of divide the work, but it is one of the most important ones for sure to keep an eye out. Yeah, it's been your boy Miguel. Hope you enjoyed this video. See ya on the next one.